A recent proof-of-principle study conducted in rural Kenya showcased the potential effectiveness of a two-component Dimeticone, NYDA, in eradicating embedded sand fleas. The primary objective of this study was to assess and compare the effectiveness of two application methods of NYDA: targeted application on the region where the parasite protrudes through the skin and comprehensive application to the entire foot. A total of 60 children aged 5 to 12 years from 8 primary schools in Bugiri district, Bulidha sub-county, eastern Uganda, were enrolled in the study. The study employed a randomized allocation approach, assigning 2 treatment regimens, whole foot treatment, and targeted treatment, to either the left or right foot of each participant. Outcome measures included the viability of embedded sand fleas, inflammation scores, and patient-reported tungiasis-related characteristics. Irrespective of the application mode, more than 95% of embedded sand fleas lost viability within 7 days of Dimeticone application. The targeted treatment showcased a swifter reduction in viability, with proportions of viable lesions at day 2 significantly lower than the whole foot treatment group, 7.0% versus 23.4%. After 7 days, both groups exhibited comparable efficacy levels, indicating the overall effectiveness of Dimeticone in treating tungiasis. The study also underscored a substantial decrease in inflammation and tungiasis-related symptoms, affirming the therapeutic benefits of Dimeticone. The targeted application of Dimeticone resulted in a more rapid elimination of embedded sand fleas, with only 7% remaining viable at day 2. This accelerated response is pivotal, as inflammation promptly resolves upon the death of the parasite. The study postulated that the targeted approach facilitated increased Dimeticone penetration into the vital organs of the parasite, augmenting its efficacy. The findings also underscored the potential impact of Dimeticone on disrupting the normal development of female sand fleas, presenting a promising avenue for transmission control. The study's effectiveness was influenced by factors such as the thickness of the corneal layer of the skin, the precision of the application procedure, and the participants' footwear habits. Notably, the study indicated a higher efficacy in Uganda compared to a previous study in Kenya, potentially attributable to variations in skin characteristics and application procedures. In conclusion, the application of a two-component Dimeticone, specifically NYDA, exhibited notable efficacy in treating tungiasis. The targeted application mode proved to be particularly effective, providing a more rapid response in eliminating embedded sand fleas. The findings suggest that Dimeticone could serve as a safe and efficient treatment for tungiasis, especially in areas with limited access to healthcare. Further exploration of Dimeticone's effectiveness under field conditions is warranted, considering the study's controlled environment. Overall, this research contributes valuable insights to the pursuit of enhanced treatment strategies for neglected tropical diseases like tungiasis. Please remember to subscribe to our channel, click the like button, and activate the notification bell if you wish to see more content like this. Thanks for watching.